George's Unexpected Journey, a tale of mental health discovery. In a bustling city, our protagonist George, a middle-aged accountant, starts his day. He's just another face in the crowd, blending into the sea of busy lives. His days are routine, monotonous, almost clockwork. Suddenly, George clutches his chest. The room spins. He gasps for breath, certain he's having a heart attack. Rush hour traffic blares as George stumbles into a hospital. Eyes blur, voices fade. The world narrows to a single frantic heartbeat. Medical tests reveal unexpected news. George's heart is healthy. There's no sign of disease. The doctors are mystified. Their suspicion shifts to psychological issues. Could it be stress, anxiety, depression? George vehemently denies, but his protests fall on deaf ears. Forced into a psychiatric ward, George feels lost. This isn't where he expected to end up. The white walls feel cold, sterile. His fellow patients are a diverse group. Some are silent, distant, others brim with chaotic energy. George sticks out like a sore thumb. A psychologist, Dr. Lee, greets George, her voice soft, comforting. But George resists, convinced there's been a grave mistake. Slowly, George settles into the rhythm of ward life. Group therapy sessions, one-on-one consultations, medications, it's a whirlwind of new experiences. In therapy, George grudgingly opens up. He talks about his life, his job, his loneliness. Words pour out, much to his surprise. Dr. Lee listens, nodding, understanding. She tells George about anxiety, a condition that might explain his symptoms. George is skeptical. Night falls. George lies awake, the ward strangely quiet. He stares at the ceiling, thoughts swirling. Could he really have anxiety? Days turn into weeks. George hesitantly connects with his fellow patients. He shares meals, conversations, even a few laughs. Friendships bloom in unlikely places. One patient, Lily, captivates George. Her story resonates with him, her struggle mirroring his own. A kinship forms, built on shared experiences. Dr. Lee introduces cognitive behavioral therapy. George learns to recognize and challenge his anxiety. It's hard work, but he's slowly making progress. George begins to accept his diagnosis. He acknowledges his anxiety, his mental health. It's a small step, but a monumental one. He finds solace in art therapy, creating abstract paintings that express his emotions. Each brushstroke brings a sense of catharsis. George attends a yoga class. The gentle movements, the deep breathing, it calms his racing thoughts. He feels peace for the first time. Lily encourages George, shares her own coping mechanisms. They grow closer, their bond strengthening with every shared struggle and victory. George's perspective shifts. He sees his situation not as a punishment, but as an opportunity to understand himself better. He participates more actively, seeking help instead of resisting. He's no longer a passive patient, but an active participant in his treatment. His anxiety doesn't disappear. Some days are harder than others. But George learns to manage, to cope, to live with it. George's journey isn't easy. There are setbacks, frustrations, but he finds strength in the supportive community around him. One day, George is told he's ready for discharge. He's nervous, yet excited. He feels different, stronger, more self-aware. George exits the hospital, the city noise welcoming him back, but this time, he's not just another face in the crowd. He's George, a middle-aged accountant and an anxiety survivor. His journey of mental health discovery has reshaped him, given him a new perspective on life. George's heart may never physically ache again, but he knows now that mental pain is just as real, just as important to address. Back at work, George adapts. He practices mindfulness, takes regular breaks, prioritizes his mental health. His colleagues notice the change. George reaches out to Lily. Their connection continues outside the ward. She's not just a fellow patient anymore, she's a friend. George joins a support group. He shares his story, listens to others. He's no longer alone in his journey. In his spare time, George continues to paint. Each canvas is a testament to his struggle, his victory, his ongoing journey. George's story is a reminder. It's a call to prioritize mental health, to confront our fears, to seek help when needed. George's life has changed. He's not just surviving anymore, he's truly living. He's turned his unexpected journey into a powerful narrative of mental health discovery. In this bustling city, George stands out. He's not just another face in the crowd. He's George, a beacon of strength, resilience, and hope. And so our tale ends, but remember, George's journey, his struggle, his triumph, is just one among countless others. Let's keep the conversation going for the George among us for the greater good.